and Madam Mamta for giving us this wonderful opportunity. And it's indeed a pleasure to be sharing the dais, even though online, with Dr. Prashant from Asta. Over here, I'm extremely excited to be a part of this particular event, and this is my second presentation happening at RV Institute for Nursing and Physiotherapy. And as mentioned, I'm here to speak to you all on the account of organ donation and Gift Your Organ, an NGO which I'm a part of. Organ donation is something which is extremely close to my heart. So that is the reason I had taken up this particular project way long back, over 10 years ago, when this was a thought which just inculcated in our minds. And today, over a decade later, we've been able to make a certain amount of progress, even though not very large. But yes, because India, it's the need of the hour, it is required. And that is how we are going to probably make India a country where there'll be no deaths due to lack of organs. Over here, all of us, whenever we speak about organ donation, a lot of people tend to feel very icky or very uncomfortable. But over here, I am not here to make you all feel anything uncomfortable. Over here, I'm going to talk to you about something which is the best thing to happen in the history of medical science, and that is transplantation due to organ donation. Chronic heart diseases, kidney failures, liver diseases are common across the globe. All of us would probably know one person or two who is currently would benefit from a procedure like this. All of us would know one person who's currently undergoing a dialysis. All of us who know that we can end this person's suffering. We can bring back the joy in his or her life, the same way this person who used to live before he fell sick. The act of donation can bring about profound meaning to the donor's life, because the act immediately impacts the life of the recipient, but also impacts the life of the family and the loved ones surrounding the recipient and the donor. The recipient and their families are indebted for life. They will thank that one individual and their families for giving them and their loved ones a new leash of life, and they will always remember them in their prayers and in their thoughts. And this cycle of giving can continue by influencing others to consider donation, either when we are alive or when we pass. I would like to shed some light on Gift Your Organ. Next slide, please. Okay. What is organ donation? Organ donation is when healthy organs and tissues are transplanted from one person to another in order to replace the deceased or non-functioning organ, either to improve or save somebody. Organ donation is about gifting life to another, and it's about celebrating life and living beyond your lifetime. Next slide. We have bifurcated organ donation into three: live, and within deceased donation, we have a case of natural death and we have a case of brain death. In the case of a live donation, it's mostly respected to kept under kidneys and liver. According to the Indian law, it's only immediate family members who can donate. Over here, you can give your sister, you can give your dad or mom, and you could receive from them, but it cannot be given on the outside. But when we come under deceased donation, there's a case of natural death when someone passes away at home, and then we have a case of brain death, which I will explain in detail later. What is a deceased donation and under natural death causes? When a person suffers a cardiac arrest, only eyes and certain tissues such as skin can be donated. What is brain death? In brain death is when it's a non-reversible end to brain functions, and that's when brain functions tend to stop. but your heart continues to beat because you are currently on a ventilator, which is keeping the oxygen supply to the other organs. So this is when, is also known as cadaver donations, and this is when that these organs can be harvested. Next slide, please. What is brain death? Brain death is when brain function dies, but the heart continues to beat, and this would eventually stop due to the lack of oxygen. And a brain death is something which is declared over a period of 6 hours, where repeated tests are done across various different panels of doctors, where each one would declare that particular patient brain dead. And it's only after this will the procedure of cadaver donation begin. Next slide, please. What are the common causes of brain death? Road traffic accidents, strokes, a brain hemorrhage, a brain tumor. In India, every year there are over 140,000 people who are involved in road accidents, out of which 67% of them land up with head injuries. That is 93,000 potential donors. And each donor is able to save 8 lives. So if we do our math, 93,000 into 8 is the possibility of getting organs for the people who really deserve to get a second lease of life. Next slide, please. These are organs and our organ harvest time. So these are the organs which one can donate in the case of cadaver donation. That is liver, lungs, kidney, the heart, the pancreas, and the intestine. It is in these limited hours that we should be able to harvest these organs and transplant them into the receiver. Next slide, please. What organ tissues can be donated? Cornea and eyes, soft tissues, heart valves, vein, bone, and skin. Next slide, please. And how organs are allocated. Potential recipients agency, and over here we had Dr. Prashant, who had already shed a little light on that aspect. And second is blood and tissue type. Third is waiting time. And fourth is the location of the recipient in relationship to the donor. The medical team attending a patient in a hospital is there to save their lives. And they do it with complete passion just to make sure that the patient walks out of the hospital hale and hearty. But the medical team attending a patient in a case of a brain death condition are totally different. And there is a rise in the number of hospitals today who are able to conduct transplantations in their premises. We all would remember a few years ago, 23 organs were harvested from 5 brain dead patients, and all this happened on a single day at the Apollo Hospital in Chennai, and it was on the news as well. Our Bangalore police has been extremely supportive, and you all would have been aware and watched the news then that how a beating heart from one brain dead patient in Bangalore was flown to Chennai to be transplanted to a receiver there. And the green corridor was created by the Bangalore police. And when traffic was halted to allow an ambulance to reach the airport on time and to make sure that this particular transplant was possible. Chennai, on the other hand, also created a green corridor where they had held back traffic to allow the ambulance from the airport reach the hospital so that the receiver could get his particular organ. Next slide, please. The need. In India, there are over 1 million organs. There are over less than 1 million organ donors registered over here currently. There are over 3 million people have died in India due to non-availability of organs. Currently, there are over 10 lakh people waiting for an eye transplant. There are 2 lakh people who are waiting for a kidney. 50,000 people are waiting for a heart. And every 2 years, every year we lose 2 lakh people due to liver diseases. This is the great need to educate and promote organ donation among the citizens of India. Next slide, please. The numbers in Karnataka. Ever since COVID-19 broke out last year in March, Karnataka has seen a steady decline in cadaver donations. It was before 2019 that we were seeing a gradual growth which was happening. While there were 105 cadaver organ donations, only 35 were recorded up to last year. Current year, we are at 26 and only 4 since April, since the second wave. And this particular data has been shared by Jiva Sarthake, also otherwise known as the State Organ Tissue